Good morning, everyone. My name is Donna Laybourne. I am the workflow lead for the Lumio project, responsible for inpatient, provider documentation and orders. And I would like to present briefly a demonstration of a patient who is in the ED department who is going to be admitted. So the ED to admission workflow. Just for level setting, we're really focusing on the steps and not so much the content of the chart or the information that's going to be provided. So where we are this morning, you can see we are actually in a patient's chart, and this patient is BPMH, KTW, 6 do not touch, okay? And you can see the banner bar here. The patient, even though it says they're in the room, they are just in the ED department, and you've been consulted as a hospitalist or an internal medicine to actually go down and see a patient for admission. And the first thing I'll show you just very quickly is the provider handoff tool. And with this handoff tool, we look to, after we develop our patients lists, of which the consulting where's my consulting physician list has been made, I can go to the provider handoff. Once a consult order has been provided by the ED and my name is inserted into that order, you will see the patient shows up on my consult list. And so that's for ease of access to the patient's chart, as well as to start to populate the handoff page. So what we'll do is we will go into the patient's chart via that. And you can see up top here, you see here, right? They have different what's called M pages, and the M pages have certain workflows attached to them. So for this patient, we're working from the inpatient workflow. So this patient is going to be coming in. And so the very first thing we're going to do, right, once we've decided to admit the patient, is we're going to place a patient admission order. Now that might be different for some of the current state right now, where perhaps an admission order was placed within the power plan or the order set that you previously were using at your organization, but this is a standalone order. It's very, very important to place in real time as much as possible, because it starts off a whole cascade of other information so that the patient can get the proper care that they need and get in the right bed. So what we're going to do here is we're going to go into the new order entry, and we're going to do patient admission order. So you would do patient admit, and you can see it. Oh, sorry, I don't have a, there we go. You can see it there. And you just single click instead of double click, and you're going to go up to what's called your orders for signatures box, or the sort of, Amazon sort of checkout box. And we're going to click on that. So we're going to modify the details. Bring that over here. PA order, and you can see there's various categories of where we're going to admit to. So we're going to admit as an inpatient. I'm going to right click on that. And you can see there are mandatory components here. You can see them from an asterisk. You can also see them from the yellow box. So for this example, right, so we're going to admit to the medicine department. The patient already is in a bed, so we don't need to request a bed assignment. But if they were in the ED and they didn't have a bed assigned to them yet, then you would click yes. Okay, but for this case, we would say no. So levels of care. So if they're going to award bed in medicine, we would click medicine, right? And this will help identify for your bed traffic department, or for admitting, or for patient flow, exactly the type of bed that this patient requires. What's also important that I highlighted in the patient list and the patient handoff is really around the most responsible provider being put in here. So you've been consulted, the ED has called you and said, hey, can you come down and look at this patient? Or I have done that. And so in that consult order, they would have put my name in there, and you could see that it populated to my consult list. By putting the most responsible provider's name in here, it will go to their list. So for whoever is going to be the admitting or attending provider, which we'll say for the sake of this is going to be me. You would put this in here. So we'll say this HOSP. And we're going to initiate that. Sign it, sign. And you can see up here, we need to refresh in order for it to take place. You can see the refresh button there. And so this will refresh. So we know the patient's going to be admitted. So now we're going to do some of the workflow or some of the work that gets involved. So we would talk about the chief complaint, and that could have been done before you place the PAO. We can say that the patient has a swollen left leg, red and painful, right? So, oh, I can't spell. And then you're going to sign it. And you can see you have up to 255 characters to describe something, okay? And after that, and again, while these components are taught in a linear fashion, they're really interchangeable with how you do your work. So what we know that needs to be completed is this problem list. And we're going to talk about the problem list really, really quickly. And there's more training, more intensive training during your training times. So really with the problem list, we're looking at this visit, right? And so we're going to place, cellulitis is what we're going to say as the diagnosis for the problem. So you can get very specific. In the drop-down list, it said cellulitis of arm, of leg, right leg, left leg, that kind of thing. So we know we're going to treat it at this visit. That we know of. It's not a chronic or reoccurring diagnosis that he or she has. It's a her, sorry. And what we're going to do is we're just going to go in and we can modify anything we need here. So it's going to be the admitting diagnosis per se, and there's other specifics that you can put in here. But due to time, we're just going to start with that. Okay, so that's that. So we've identified a diagnosis. Next, we're going to actually do home medications. And so very important to know, and there'll be further explanation and training, is that with the home medications, first before, and this would actually normally be a blue circle with a white exclamation mark saying that it's not been completed, but I'm repurposing a patient. So it looks like it's been done already. But the important point here is that the meds history or the BPMH needs to be complete first before you can complete the admission medication reconciliation. And so just for the purpose of this, some physicians do it, some providers do it, sometimes the nurses do it, sometimes the pharmacy techs do it, but there needs to be something populated before you can go ahead and do the admission med rec, right? So I'm just going to add, then you just add like atenolol. We'll say atenolol 25. There we go. You can see here, I'll drop down. It looks all good. And we're going to document it as that's their only medication, right? Also, so in the problem list, due to the atenolol, you probably have hypertension. You would have added that in the problem list as a chronic and this visit, because if you're going to treat it here, then you put it in as this visit. If it's just a chronic problem that you're following, then you would put it as a chronic problem. So as you can see now, the meds history, right, is here and the check mark is there. And the admission, we can go into the admission medication, right, which is here. And you can see by the scroll that this is a home medication. You can see by the orange circle and the star that this medication needs to be reconciled. And actually, and you will be very familiar with this by the time you're through all your training. If you just hover over something, it will provide extra information. They use the phrase hover to discover. So do you want to continue this medication to be ordered while the patient is in the hospital, or do you want to stop it? So essentially we would continue that. You can see now it's an inpatient hospital order, 25 milligrams, 1 tab, by mouth twice a day. And we're going to sign that. Right? Again, the medication reconciliation, that process doesn't have to be the very next thing that's done, but it does need to be done before your note is complete. So let's go down and we can take a quick look at some of these things here. With the problem list, your home medications is done. The goals of care, we're going to order, when we place some admission orders shortly, we're going to take a look. So here's some labs here from your, from the ED, we'll say. We just populated some labs here. And then this is information that will flow forward from previous admissions as well as from nursing admission documentation. This is where you can look at old documents, intake and output, same thing. So we've got a set of vital signs here that we've also placed, so you can see those, and then any orders. So you can see here from your ordering profile, there are several orders already. There was the consult to hospitalist, which I spoke about. So that is an order that's been done. And you would go in and you would document on that through the consult note, and then you would complete the order. So this is your admit to inpatient order, which is done. And then these are system orders that occur automatically based on the patient being admitted and are completed by nursing. And you can see medication wise that there is this here. And you can also see here, scheduled, continuous, all of that stuff. So we're getting down now to the documentation piece, and you can see most, if not all, of the information that you require for your notations are in fact in this one page, right, with all of these components. And so what we're going to do is we're going to just complete some documentation that will flow through to your admission note, right? So you can see here that there's a diagnosis of cellulitis for your assessment and plan. And you can figure out whether you want to do this first or you want to do this last, right? So subjective history and present illness. So we actually have some auto text that we can use for that. And I'm going to show you the auto text, but I'm not going to complete any documentation. So it's this and sorry. And it's HPI component. And so right now it's not working. We have that in to be fixed, but it would document something here that auto text wise where you can actually populate there. So we can just say patient having difficulty walking due to pain. Right. We'll just go from there and then you're going to save it. Okay, very good. You can see up here with this button here, where it says manage auto text, so you can develop your own auto text, or in fact you can use somebody else's auto text and bring it in for yourself, but that's where you would access the auto text. So again, objective physical exam and review of systems. So again, the auto text piece, so that I'm going to use PE complete. And you can see all the auto text here. And so I'm just going to save that as documentation, and review of systems the same. Review of systems, right? Complete. Again, for those of you who understand auto text already, this using Dragon or just auto text in general, you can see how this will work. So this has now all been populated. And so now the next thing we're going to do is we're going to go to, we're going to place some admission orders. So we're going to go back up here to the new order entry, right? And we're going to place admission. CU admission. So med admission to medicine or hospitalist. And again, we're going to go up here and we're going to modify some details. Bring it over here. So first glance, you take a look, you can see some things are already pre-populated. Fair amount is not, so you can take a look and see what you would like, right? So have you had a conversation, or are you aware of the patient's goals of care? So then you would click on that, We're going to modify that. And what's going to pop up is a power form. And this is using that new model of RMC. And so there'll be some education on that if you don't already know about it. And you can see it's fairly straightforward with the graph. And then it provides each category with what these definitions are. So this is a young person who just has cellulitis, no chronic history. So we're going to go with the fact that they are healthy. We don't need to fill that out. So this is anything in yellow is mandatory. So what we're going to do here is we're just going to say healthy. We'll go from there. And so we're going to go up to the little check mark here and we're going to sign it. Okay. And you can see here, this is what the order looks like. But because we have other orders that we're going to want to place, I'm just going to close it down for now for when we sign it all through the order set. So again, a diet. Right? Do you want them to have a diet? We'll just have them have a regular texture. Again, because we're in a smaller order set, we need to return to the bigger order set before we can order everything. So we're going to do activities tolerated, vital signs, oxygen therapy. We don't need blood cultures. We don't need that. We'll do saline law. We don't really need IVs right now. We'll say VTE prophylaxis not indicated. And you can see here a blue circle with an X means that there are details that are mandatory that need to be filled out. So why? So he's fully mobile. She is fully mobile. My apologies. And so again, we're going to click on the little down arrow there. And then are they having a bit of pain? So we can order some acetaminophen and go from there. The blood work has already happened, so that's fine. We'll maybe order a CBC. We don't really need a chest x-ray. Do you want to consult anybody? We don't think we need to at this point, so we're going to initiate now. One of the things just before we initiate is we can do several things here. We can add to phase. So if there's an order that you want to add to the power plan, that's when you would use this add to phase button and you can add an order. Okay. Also up here, there's a funnel and there's a merge view. So the funnel, if you take a look at that, you can see everything that you ordered. So in a snapshot, right? Everything that you ordered, and you can review it that way. The funnel, what the funnel does is it looks for duplication of orders. So if in fact you are, making sure that you aren't ordering things more than once, you would take a look this way as well. So we've done that. Everything looks good. And we're going to place an order for signature and we're going to sign. Okay. And we're going to refresh. So the final thing we're going to do very quickly is we're going to write our admission note. So our admission history and physical for create notes is down here for ease of use. And you can see lots of things have been pre-populated already. So this is where you would write your assessment and plan. And do you want the orders there? So that is hardwired into Oracle. And so some would like to have their orders, some don't. You can individually get rid of the orders that you don't think are necessary, or you can just get rid of all of them. And you could write something here, cellulitis, whatever that your plan is. I'm just an IV antibiotic therapy, step down, in oral, and discharge. Well, you wouldn't probably discharge, step down, oral. So this is that, okay? And you can see you've done all of your pre-work here and your problem list. So past medical history, they don't really have any, or we didn't write anything down. And then historical resolved, anything that they've had in the past, have they had a previous cellulitis, would be located here. Any procedures or anything. So you just take a quick look here. Also, one of the things that we have to do that's not brought forward automatically are lab results. And we'll talk about tagging in other training, but we'll be able to bring those lab results forward by tagging. And then what we're going to do is we're going to sign and select. And here you can see that we're going to sign. If there's anybody who you want to also review this or have it CC to them, this is the opportunity to do that. If you're a medical student or if you are a resident who the attending likes to actually have have reviewed the documentation, you could do that. So I could just say that I'm going to CC it to his intent. So I'll just do that. To another doctor. And if it's somebody who you do all the time, right, you can just favorite it and it stays over here. And you have the choice of having them sign it or review it, and it will go to their message center. So you're going to sign. And you will refresh and you will see that it clears for the next day, for the next time you document. You can go into this blue menu that we talked about, and you can go to documentation, and you can see that it's here for reference. So those are the high level steps in order to admit a patient, and all of the key pieces of information that you might need to get yourself started. So thank you for joining me, and I'm happy to answer any questions in the future. Thank you.